So today's video is going to focus on classification of bones and then bone markings. This video doesn't have tons and tons of content. What it has, though, is lots and lots of vocabulary. There's a lot of vocabulary associated with bone markings in particular. Okay, so let's look at our 4 classifications of bones. So our first one that we have here is a long bone. And we talked about long bones before. So some characteristics of long bones is that they are longer than they are wide. They are made of mostly compact bone, or that cortical bone that's made of those osteons. Okay? They contain a shaft. If you remember before, the shaft was our diaphysis. So they contain a shaft as well as a head or an epiphysis at both ends. And that doesn't necessarily have to be a big rounded head like this one. It can look like this one down here on the bottom. Really, the thing with the epiphysis or the head is that it's where the bone is widening. Some examples of long bones: humerus, so that's what this is right here. Okay, so the humerus, which is the bone in your upper arm; femur, which is the bone in your thigh; ulna, which is in your forearm; tibia, which is in your leg; phalanges, even though they're relatively short, they're still longer than they are wide. Okay, for our fingers, our toes. Okay, when you most commonly think of a bone, most people are usually thinking of a long bone. A short bone is roughly cube-shaped. And by cube-shaped, we mean that the length and the width are about the same, whereas your long bone was longer than it was wide. So these are about roughly the same length and width. These are short bones are mostly spongy bone, so with lots of trabeculae, lots of openings in them. And some examples of short bones would be your patella, right, which is our kneecap. We can see the carpals, which are right here, these bones in our wrist, as well as the feet, or the tarsal bones that make up the feet. In addition to long and short bones, we have flat bones and irregular bones. So flat bones are thin, they're flat, and they usually have a curve to them, meaning that they're kind of rounded like this, like the skull bones, the bones of the skull. You can see the rounding here. The bones of the ribs, which would round around as they come to the chest. So a flat bone consists of a layer of spongy bone between 2 thin layers of compact bone. So we'd have these bones aren't very thick to begin with. We'd have 2 thin layers of compact bone, and then we'd have this layer of spongy bone squished right in there in between them. So some example of our flat bones would be our skull bones. So you guys will learn frontal, parietal, temporal. The ribs, the sternum. On this image over here, you can see lots of our axial skeleton here is going to be considered a flat bone. So the irregular bones, basically these are just bones that don't fit any of the other 3 types. And so some common examples here would be the pelvic bones, right? They're kind of odd looking, as well as the vertebrae. So they're not longer than they are wide. They're not roughly cube shaped. They're not this nice thin layers of compact bone with spongy bone wedged in between that are kind of rounded. And so all of our other bones would fit there into that irregular bone category. Okay, so let's take a look at bone markings. So bone markings, like I said, we're going to be pretty heavy on vocabulary here. So these are the surface features on the bones. When you watch your CSI type shows, or if you watch that actual show Bones, and they talk about the markings and the tuberosities and the tubercles, these are the things we're talking about, okay? And we're going to go through what each of those things mean. So these bone markings, basically what it is that our bone isn't completely smooth. It might have small openings in it. It might have like roughened and large kind of bumps on it. And these bone markings, they're going to allow for attachment for things like our ligaments, which remember are connecting bone to bone. They will allow for attachment for tendons, because tendons are attaching bone to muscle. And we have muscles that will attach directly to the bone. So these bone markings are, as a general, grouped into allowing for attachment or opening, allowing for passageway for our nerves and our blood vessels to get where we need them to go. So we're going to start with bone projections. So these are all 4 of these here are basically forms of rounded types of projections. And that's why we grouped them all together here. So the biggest one is going to be the trochanter. And what's special about a trochanter is it's on the femur only. It's these big lumps sticking off of the bone here. We have a greater trochanter and a lesser trochanter. And when we get to appendicular skeleton, those will be on your structure list. Okay, so these are the biggest, largest projections. And again, they're on the femur only. A tuberosity is kind of medium sized. It'll be like a small bump. Okay, but again, a medium sized bump, it'll be rough. Okay, it'll be rough because it's usually a tuberosity is not usually in the joint. A tuberosity is usually down the shaft of the bone. And so there's kind of a significant amount of fibers spreading out and attaching to the bone there and pulling and tugging on the bone. If you feel down just below your knee, down the front of your shin, that big bump you feel on the front of your shin just below your knee, that's an example of a tuberosity. That's your tibial tuberosity. So a tubercle is going to be a little bit smaller. It's going to be a little bit more round, okay, and it's going to be a little bit smaller. You can see these tiny little projections down here. Okay, there's a tubercle there on the humerus. Okay, these are just tiny little projections that, again, they won't have such a broad attachment, which is why they're a little bit smaller. And they're not so rough. They're more of a concentrated, the muscle has gone down to a very tiny attachment point. Okay. And then your epicondyles. Epicondyles are going to be, epi is upon or above. These are going to be right near the condyles. So for instance, if we look at this femur here, we see these condyles down at the bottom. Okay. These bumps right here above them, okay, those would be your epicondyles. Okay, and we're going to see these epicondyles. This would be an epicondyle. This is an epicondyle right there. We're going to see these epicondyles near joints. Okay, and these are allowing for attachment. For the muscle to actually move the bone, the muscle has to cross the joint, right? I've got this big, long muscle bone here. If I have a muscle attached here and then come down here and attach here, nothing happens, right? It's like a board. But if I have a break, and I have a muscle attached here and it attaches over there, well, now I can get movement. Okay, and so these epicondyles are places where the muscles come across and they attach on near the joint so that you can have good movement there. Okay, so these three here, so before with our trochanters, tubercles, tuberosities, epicondyles, they're mostly rounded projections. These three are thinner, sharper projections. Okay, as their name implies, crest, line, spine. So the crest is usually the widest and the thickest. You can see this, like this whole top edge of this bone here is considered a crest. So a wide, thick protrusion. You have a lot of muscle that's attaching up here along this crest. Lines are going to be thinner. They're basically going to be a ridge that will kind of run the length of the bone on the back of, all right, let me see if I can do it with this pen. Probably not with this terrible pen. Oh my gosh. Don't laugh too hard while you're at home at this horrible drawing of a femur. Okay, it looks like a weird dinosaur thing. Okay, but down the back of the femur, there's a line that runs basically the length of the back of the femur where, again, muscles will attach into it. And then a spine is also going to be thin, but it's usually more prominent than a line. You can see a spine sticking out here. If you touch your pelvis, okay, like the points of your hips, when we talk about we go out and we touch our hip bones, the point of your hip there, that's that spine that you're touching there. So a prominent protrusion off of the bone. Across the back of your shoulder blade or your scapula, that's also a spine. So again, pretty thin, but really prominent protrusion. So these are some of the processes that are going to help form a joint. So tubercles, tuberosities, trochanters, spines, crest, line, they're not necessarily associated with the joint where the two bones come together. Okay, but these bone parts are. For instance, a head. Okay, so a head is going to be a large round projection. You can see it right there where the head of the humerus is fitting into the scapula. The femur has a head on it, large round projection to form those ball and socket joints. A ramus is a straight section of bone that's going to form the joint. Okay, so up here on the top right, you can see the ramus of the mandible. So this is a ramus, this straight section of bone here that is going to go up and form that joint. Condyles are usually paired, so we're usually going to see two of those. You can see on the mandible here, this jaw. Again, I've got a condyle on the right and a condyle on the left. Okay, so the condyles are going to be round, smaller, rounded projections that will form a joint. Basically, they're smaller than a head. And then facets are going to form joints in kind of an odd way. Basically, with a facet, you've got kind of two shallow grooves here that will form a joint. And you can see this right here in the vertebrae. And this will probably make more sense when you are looking at your axial skeleton materials. Put a couple vertebrae together and you can see where those facets are formed, and that shallow surface there that helps them make them form the joint. As for openings in the bone, okay, we've got a foramen, which is a nice, almost perfectly round little opening. You see right here, there's an example of a foramen. These are going to allow passages for blood vessels, for nerves. A fissure is a bigger crack-like opening. You see it over here on the right, these big, large, like canyon type openings. Again, allowing for passageway of blood and nerves, in particular in the back of the eye there, the large optic nerve. A sinus is an opening in the bone, but not an opening for like a passageway. A sinus is just a hollow portion of the bone. You can see them colored in this diagram down here, the green and the purple and the blue, the like reddish pink on the side here. So they're basically just a hollow opening of the bone. They're going to help make the bone lighter, and they help resonate sound. They impact your voice, which is why we sound kind of funny when we're sick. When we get a sinus infection, these are lined with mucus. When we get a sinus infection, you know, we get bacteria trapped in there and we start producing more mucus. We get all stuffy, you know, trying to clear that out. And then you have a meatus, which is a long, hollow opening in the bone. Really, you only see this for the ear. Okay, so you can see right here on the side of the skull, that would be your external auditory meatus. So there's a large hole through the base of the skull there, so that the sound waves can travel into where the receptors for your ear are. Okay, and our last bits of vocabulary for this are just indentations. So these are indentations. They are not full-blown openings in the bone. Okay, they are just indentations, or I don't know what another word for indentation would be in the bone. Okay, so our first one is a groove. So a groove is a thinner indentation. You can see it right here. Okay, again, there's not an opening in the bone there, but there's an indentation for the vessel to rest in, to sit in. A fossa is a larger round indentation. If you remember when we saw the humerus head before, there's the fossa right here. Okay, and that humerus, or your arm bone, is going to come up and fit right into this rounded fossa. Okay, so again, I don't have a whole opening in the bone. I just have this indentation that's going to help me form the joint there. Okay, so not overly difficult material, again, but a lot of vocabulary. So we'll practice it in class, most likely maybe with a Quizlet, okay, but you'll want to spend some time with that vocabulary.